Good afternoon, everyone. Thank you for being here. I'm honored to be joined by Dr. Joseph Kanter, who's the Assistant State Health Officer for Louisiana, Dr. Leo Swanee, Ochsner Health Senior Vice President and Chief Academic Officer, LCMC Health Physician Dr. Robert Matheny, and he has a specialty in cardiology, as well as our Emergency Management Director Joe Valiente, and Shari from the Deaf Action Center. So thank you for being here. Cases in Jefferson Parish, we wanted to give you a COVID update and obviously the exciting news about the vaccines this week. So as of today, there's 28,045 cases in Jefferson Parish. Unfortunately, we had 644 deaths since this started for us in March. We also want to keep in mind the families. I mean, we're approaching the holiday season, the Christmas season. We know for 644 families, it's going to be a different type of Christmas. It's always hard to get to the holiday season when you've lost a loved one, so it's certainly a lot more people than any other regular year that are going to be having a little bit more difficult season, so we want to keep them in our prayers. And 378,889 tests that have been conducted in Jefferson Parish. So for the past month, we find ourselves in what is the third surge. We had a good 3-month plateau, August to mid-November. We went from starting November as a state, one of the few states in the United States that was not rising in Jefferson Parish, and at the early November we were at 35 cases a day, to now what we're realizing in the past 5-day average is 272 cases a day, over a 7-fold increase. So we want to stress the importance of next week, the Christmas and the holiday season, and the celebrations that we are so used to having, and the many strong family traditions that we have. You need to make your plan now for a different kind of celebration and a different kind of way of celebrating the spirit of the season. We know that the lowest risk of spread this holiday season is to spend time in small gatherings and with people who live in your same household. Indoor gatherings pose more risk than outdoor gatherings. More people at your celebrations pose more risk than fewer people at your celebrations. So crowded, poorly ventilated indoor spaces is not what you want to be doing. That is the most risk, and that is absolutely the situation we all need to avoid. We also know travel may increase your chance of spreading COVID, so the CDC is continuing to recommend that people should postpone travel and stay home this holiday season. We want everybody to remember all of those things that we know all the time, the things that really apply, are really tools of fighting this: wearing a mask, social distancing, washing your hands often. And we want everybody to work together this season to get through this season. Remember, we enter next week with a lot of virus in our community. Holiday gatherings take people out of their normal day-to-day operations. If you go to school, if you go to work, the holiday gatherings just bring you encounter different people in your friend and family group. And remember, there's a delay in when we see the activity and we see the positive cases happen, and then another delay for the hospitalization. So right now, we are in the midst of a 10-week period of a lot of holidays and gatherings. We had Halloween. If we're going to say Halloween caused us to go up in mid-November, and it was about 2 weeks since we noticed that. Then we had Thanksgiving. We're seeing the result of Thanksgiving gatherings. We have before us next week Christmas Eve, which is a separate celebration from Christmas Day. I know in my family we do something Christmas Eve, and we're with different people Christmas Day usually. Then we have New Year's Eve, and then New Year's Day. And then right after that, all the college kids go back to school. Students go back to school. A lot of movement around, a lot of different activities in a very compacted time frame. So again, as we saw at the end of the Halloween, our numbers went up by mid-November. Our numbers are after Thanksgiving. We don't have time to plateau before this next holiday gets on us in this 10-week period. We don't have time to come down. So we're entering every successive holiday at a higher number. And that's a dangerous situation for us as a community to be in, and it's something that we need to realize, change our behaviors so that we don't have as much risk. Okay? Remember, a lot of virus in the community means more people have it. It means higher risk of all of us getting it. So if you're assuming that you're going to get a mild case, and that may be true for you, it doesn't mean you're not going to pass it on to somebody else who's going to have a very critical case and a life-threatening case. So you need to think beyond yourself. That's what we're asking you to think beyond yourself. Testing next week, we have, and I want everybody to, pay attention to testing because testing is going to be more limited next week, it being, the Christmas season. So on Monday, 9 to 1 at Celebration Church on the Kanter campus. Wednesday, December 23rd, from 9 to 1 at St. Michael Baptist Church in Kanter. Wednesday, December 23rd, 2 to 7 at Tarrytown Golden Age Center. Monday to Wednesday, we're having testing, as we've been doing at the Ilario Center in Westwego from 8 to 4. Now, the Ilario Center is going to be closed Thursday, December 24th, Friday, December 25th, Saturday, December 26th, and Sunday, December 27th. We're going to give our folks a much-needed time to rest. It has been a very long year. Louisiana National Guard has been helping us support the site also with many other groups, but we know they're not close to home, that they come from other areas of Louisiana, and we want to give them the few days to be able to spend with their family after being with us the rest of the year. So pay attention because, again, testing will be limited during this holiday season. You can stay updated every week with new testing sites by visiting covid.jeffparish.net. So on to some really exciting news that our country has been this week was with the vaccines. It's been a week ago since one of the first vaccines, the Pfizer vaccine, had emergency use authorization by the FDA. So I feel like for the first time since March 9th, we're not just a victim to COVID, and we're not just trying to constantly defend ourselves, but now we go on the offense, and now we have a weapon. And so I feel a renewed sense of energy from that. Moderna, right now as we speak, are in the final discussions. The advisory panel has given a favorable recommendation. I think they're waiting for the FDA emergency use authorization vote on that as we speak. So it really is a very, very exciting time. Our healthcare heroes among the first, and rightly so, to be taking this vaccine now. So that's just really knowing that you might have friends and family and neighbors in our community now actually getting that vaccine. Many of the people on the stage with me have already taken that vaccine. Really means we've turned the corner on this, and as everybody's saying, it's a game changer that we're witnessing before our eyes. The science is clear, the vaccine is very effective, 94 to 95% effective on the first two vaccines that are coming out. I know that when it's our turn in Jefferson Parish government, I will be taking the vaccine. I don't know anything about messenger RNA. I don't know anything about all the studies, and if you look it up, there's tremendous research and data. But what I know is that the people who took care of the worst case scenarios of COVID, the people who were fighting for their lives, even when their families couldn't be at their bedside, the healthcare professionals that took care of those people and saw it at the worst, they're all taking it. And that's all I need to know. I'm convinced that that's what I need to know to make my personal decision. It's a personal decision. I'm going to encourage my mom to take it. I've asked both my children, they want to take it as soon as possible, and they will be probably further down the line because they're healthy and they're young. So you need to go through now and start making those decisions for yourself. Again, I feel a renewed sense of energy in this long fight. I heard one doctor, I was listening to something, and I heard one doctor call it, it was like he was looking at the horizon and he was seeing the sunrise again. And so vaccines are certainly our pathway to the more normal life that we once enjoyed. So that's why this afternoon I wanted to invite our local healthcare partners. Both Ochsner and LCMC representatives are here to provide an update on the vaccinations. We also are going to call up our Emergency Management Director, Joe Valiente, to talk about the role we in Jefferson Parish government will be playing when it gets down the line, when the supply is there, and when we're ready to do a mass vaccination of our public. We'll be involved in that effort, and we're proud and excited to be involved in that effort. And finally, the end is in sight. We just want to, again, reiterate, follow all the public health measures, especially next week during our holiday time, during our Christmas time. As we are in the middle of the third surge of COVID, mask up, socially distance, wash your hands very often, have a strategy of how you're going to celebrate the spirit of the season next week. We want to tell everybody, stay in touch with us. We have a very aggressive social media channels that we update regularly. www.jeffparish.net is our website. Again, find us on Facebook, Twitter, and Instagram. And for daily alerts, text JP Alert to 888-777, or for our Spanish-speaking citizens, JP Noticias to 888-777. So with that, I want to call up, and we're so glad that he has been with us all the time, and anytime I call him, he's always willing to help, Dr. Joseph Kanter, who is the Assistant State Health Officer, and you know him well. So, Dr. Kanter?
Good afternoon. Thank you, Madam President. Thank you for all the leadership that you've shown. And docs, thanks for joining it. Ochsner and West Jeff, really happy to have you. Thank you. What a great way to frame it, Madam President, that this vaccine is us fighting back. And that couldn't be more accurate. We've been taking hits for 9 or 10 months now. And we can finally see how we get out of this. And that's from the vaccine. And I'll tell you, every single person that takes it from here on out, it's going to be a potential life saved, and that's going to be one step closer to putting this thing behind us and getting back to normalcy. This is how we get back to normal. The end is in sight, just like you said, Madam President, and we could not be more excited about it. I'll tell you, it is a highly efficacious vaccine, 94, 95%. That's a grand slam in terms of vaccines, and it's very safe. The safety profile is excellent. People generally can have mild side effects. They say sore arm, flu-like, maybe for a day. Beyond that, it's a very safe vaccine. I took mine this past Tuesday. I've got my card that I'm going to keep with me until I go back on January 5th for my 21-day follow-up dose. I took it with some other colleagues of mine from the ER at UMC. And it was a really emotional event, I'll tell you. There were people in the room who had lost loved ones to COVID, and then they got the vaccine, and you could really sense the hope. I mean, this has been tough. The road has been hard, and it's really nice to see what it looks like on the other end. I felt fine. My arm was sore that night, sore the next day. I woke up with a little bit of a headache, maybe a little bit warm. I don't think I had a full fever. I didn't check my temperature, but I didn't feel that bad. I took a cup of Tylenol. I went to work, and then by nightfall, I felt totally fine, and I feel fine now. So that was my experience, at least, and I was really happy to have it. What's happening now is we're in phase 1A, which is the earliest priority of vaccine administrations. So it's, as the president said, it's individuals who are on the front lines in hospitals, and that doesn't just mean docs and nurses. That means people who help out janitorial, people who help deliver food, all of it. That will continue in hospitals until we get everyone. Also in phase 1A is residents and staff of long-term care facilities, starting with nursing homes, because that's where the bulk of our mortality has been. And that will start within the next couple weeks. Pfizer is being administered right now. As the president said, the Moderna vaccine we expect to be formally authorized by the FDA any day now, any minute now, really. And then that will begin a weekly cadence of vaccine distributions. And as quick as we can get through phase 1A, then we'll move on to phase 1B. We are still looking for some guidance from the CDC. The CDC will be releasing, hopefully in the coming week, their advisory of who they believe should be included in phase 1B. Now, ultimately, it's the governor's discretion, but the governor has made clear he wants to follow the expert advice of the CDC. We reasonably believe that in this next phase 1B will be other people whose jobs put them on the front line and are essential, like first responders, police officers, parish emergency officials, and particularly individuals who are at high risk of complications should they get COVID by virtue of either advanced age or underlying medical condition. That's a broad sense of who we realistically expect to be in this next phase, phase 1B. Again, we won't know for sure until that CDC guidance comes out, hopefully this week. And realistically, that's probably, we enter into phase B more than likely sometime in January. The challenge right now is that on one hand, the end is in sight. And look, with the holidays coming, that could not be more exciting news. And for me personally, it's been a real source of strength. But the road we're on at this particular juncture is as treacherous as it's ever been before. And it's going to get worse in Louisiana before it gets better. And that's what the federal government has told us. When Admiral Brett Giroir came and visited 2 weeks ago, and when the governor went to the White House the week after that. The message was expected to get worse over the next few weeks. And the reason for that is, number one, the weather's getting colder, so people go indoors, and that drives up more transmission. Number two, it's also flu season. And even though this flu season has been mild, thankfully, because of all the things we're doing to prevent COVID, they help for the flu, there's still patients taking up hospital beds being treated for flu. Number three, we had the holidays, Thanksgiving, Christmas, and New Year's. We know that's going to drive up transmission, even though we're asking people to be prudent and responsible. And more importantly, or I should say what really is keeping me up at night, number four, we're not going to have any outside help. And the first two waves, we had outside medical providers, docs, nurses, techs come in. We had a naval attachment. We had a medical contractor who brought us in outside help to help augment our acute care capacity. Not going to be available to us this time because now every state is on fire, just like us. And so any docs and nurses that are out there are going to be needed where they are in their home states. We're on our own. What we have in Louisiana is what we have, and the docs will tell you the hospitals are getting very busy right now. So we're worried about Christmas and New Year's. We're worried that it's going to be, sorry for the cliche, but throwing fuel on the fire, and the fire is already pretty big. And so that's really what I'd like to convey to people is I want people to be excited about the vaccine. I want people to be doing research and reaching out to medical voices that they trust to get their questions answered. I believe it's a very safe, very good vaccine, but I want people to do their own research, talk to people that they trust on that, come to their own understanding. But while we're looking forward to that, we need to be more careful than we ever have been right now because it is all on the line, and that's not an exaggeration. So masking, distancing, avoiding crowds, avoiding travel, not bringing your extended family together, if there's any way to avoid that, that's what we need right now. And the message to families, and I don't mean to be grim on this, but the message is, ask yourselves, ask your parents, ask your grandparents, ask your kids, what's more important right now, this Christmas or next Christmas? That's what's on the line. Thanks, everyone.
Thank you, Dr. Kanter, for your leadership. Next, we're going to have Dr. Leo Swanee from Ochsner. Dr. Swanee and Dr. Matheny are in organizations where people are actually taking the vaccine. There's a lot of curiosity about it in your environment. Your colleagues are taking it. You both may have taken it. So we look forward to hearing what you have to share with us.
Thank you, Madam President. This is truly a historic week. As the Madam President has already said, this marks a turning point in our fight against COVID-19. And on Monday, December 14th, at Ochsner Health was among one of the first healthcare facilities to vaccinate its frontline employees, not just in Louisiana, but actually in the United States. We were one of the first ones to do it. We started at Ochsner Medical Center on Jefferson Highway, right here in Jefferson Parish. But we've now gone throughout the state, and we're vaccinating our employees in Baton Rouge, in Lafayette, in northern Louisiana. The initial wave of vaccine was distributed to frontline healthcare workers. This includes ER, urgent care, ICU, but not just the doctors and the nurses. If you are a secretary, if you're the janitor that cleans, anybody who works in and around the COVID units was vaccinated or offered the vaccine this week. It was a privilege and an honor to have been one of the first to be vaccinated in that first wave on Monday. As a chief academic officer at Ochsner, I had a great sense of pride knowing that Ochsner, as one of the clinical research sites, had helped and contributed to proving the efficacy of this vaccine of 95%. As a pulmonary critical care doctor who'll be covering the ICU next week, I personally took a lot of comfort in being vaccinated, knowing that there's early data that says even as soon as 10 to 14 days after the first vaccine shot, you start to see some benefit and some protection from COVID-19. When it was my turn, stepping up to be vaccinated was bigger than me. I stepped up to protect my coworkers and my patients that we serve throughout Louisiana and right here in Jefferson Parish. I stepped up for my family, including my mom, who lives with me in a multi-generational home, who we affectionately call Abuelita. And I stepped up for my community, hoping to lead by example to my fellow Hispanic Americans. Through the Oxford prevalence studies in Jefferson, Orleans, and Baton Rouge, we demonstrated that Hispanic and African American communities have borne a disproportionate burden from this disease. By getting vaccinated, we can end this pandemic, and no one else from our communities needs to suffer or die from this dreaded virus. I encourage you, when it's your turn, that you step up and join me in ending this nightmare. Data has shown that the Pfizer vaccine has been stated as safe and effective. Getting the vaccine will help prevent the spread of the virus and reduce your chances of getting it. And the science behind the vaccine is not new. mRNA technology has been developed for years. This is a culmination of a lifetime of many people's work. Supply of the Pfizer vaccine is currently limited, but we anticipate it will continue to increase in the weeks and months that follow. At Osher, we support and we encourage our communities to get vaccinated when it becomes available. Beyond the vaccine, I do want to echo what Dr. Kanter and Madam President have said. That while certainly this is a week of hope, optimism, stopping a pandemic requires a vaccine, but it also requires for us to get vaccinated. The vaccine is useless unless we get vaccinated. We need to think beyond the vaccine and continue to take the necessary precautions we have talked about since the beginning of the pandemic and as Dr. Kanter has outlined. Together as a community, we have shared responsibility to care for each other, and that includes staying committed to mitigation efforts like social distancing, masking, and washing our hands. And as has been reiterated multiple times, this is especially important as the holiday seasons approach. We know everyone's tired, and we recognize the sacrifices individuals are making, especially when it comes to treasured holiday traditions. We encourage everyone to rethink traditional holiday plans as Madam President has, and the choices we make today will impact not just tomorrow, but how our community fares in a week, a month, and well into next year. The end of this pandemic is in sight. Until that day when we reach herd immunity, no one else needs to die needlessly. No one else needs to suffer from this dreaded disease if we mask up and social distance while we wait for that day. And that day is coming soon. So by working together, we will put COVID-19 behind us. And this week was an exciting step forward. Thank you.
Thank you, Dr. Swanee. Next, we're going to have Dr. Robert Matheny from LCMC, who's a physician specializing in cardiology. Dr. Matheny.
Good afternoon. Thank you, President Sheng, for inviting me and the rest of us to join you this afternoon. This has been a historic week at LCMC Health, and a week our health system has been preparing for since this pandemic began. Hopes have been high for the day when we would begin delivering vaccines to our most valuable frontline employees, our doctors, our nurses, respiratory therapists, the dietary team, and as others have said, even the environmental services teams, the pharmacists, the lab workers, and many others who've been consistently delivering health care with heart to those suffering from this virus and other illnesses as well. The first shipment to LCMC Health began arriving on Tuesday of this week, and very soon thereafter, we were receiving our vaccines, including myself. We've received the vaccine at work starting on yesterday, December the 17th. I've received my vaccine and echo what the others have said, that we think that the science is solid. We think that the vaccine is safe, that it's a part of the armamentarium of activities that we'll have to participate in to make a difference. With University Hospital acting as the hub, LCMC Health is using a hub and spoke method of distributing to our other 5 hospitals in the system. All of our hospitals have been distributed to as of yesterday. Madam President, I can tell you that these first vaccines have been met with tremendous excitement and emotion in the hospital. It has been a challenging past 9 months in our hospitals, and this moment in time has been reflected in the emotional reactions that we've seen of those giving and receiving the vaccine. I've heard people talk about sharing this experience with their children and grandchildren, as we've never really experienced anything like this before. A nationwide rollout of a vaccine that has a potential to save millions of lives. On behalf of LCMC Health, I'd like to express a deep sense of gratitude to those employees who have been on the front lines, not only for their dedication over the past 9 months and before that, but also gratitude to our colleagues, both here at West Jefferson Hospital and at Ochsner, who have been among the first of their peers and colleagues to say that they have, yes, received that vaccine. This is a vital step in getting to that light at the end of the pandemic tunnel, and we're encouraging those who will follow in our footsteps across the system, which includes West Jefferson and now East Jefferson General Hospital. We're honored to care for the community. We're honored to lead and show the way. This will be an expression at LCMC Health that little extra that we bring to work every day in delivering health care with heart will be shared in our community. I will remind you that in addition to taking the vaccine, as again others have said, we'll continue to wear our masks. We'll continue to have social distancing. We'll continue to wash our hands and make those hard sacrifices during this holiday season. That means that we'll have to continue to do so. Avoid large gatherings and celebrations. And thank you, Madam President and the Council, for showing leadership in these challenging last 9 months.
Thank you so much, Dr. Matheny. Next up, we're going to have Joe Valiente, Emergency Management Director, come up and explain how we're going to be involved in this vaccine. Joe is usually here, normally dealing with weather events, and this year certainly has been very different. So I want to say kudos to his staff who've been able to pivot and deal with different kinds of emergencies that we've had to face in the parish this year. Joe.
Thank you, Madam President, and good afternoon, everyone. So I'm going to touch on the logistical and operations end as far as emergency management is concerned. The City's Ready Initiative program, which is a federal program that sets the guidelines for the distribution of prophylactics and any type of medication that has to go out to the general public. Typically, the way they do that is points of dispensing, and they call that a pod. So currently, we're operating under the closed pod, which is targeted for individuals that are at the highest risk of catching the virus. That's why hospital workers and nursing homes went first. The next group, and try to understand, this is flexible and it expands. So the next set of expansion that's going to occur will go to EMS workers and to firefighters because they make medical calls at EMS also. So they're the next group that has the highest risk of exposure. So they will go next. Dr. Kanter tells me likely once that expands again, it will go to the assisted living homes, and it will continue to expand as a closed pod until we reach the general population, at which time it'll convert to an open pod. And the open pod is exactly what the Ilario Center is for. That's why we did the October 21st mass vaccination exercise at that location with the seasonal flu to see exactly how it would work out and whether or not it would be effective. It was. We gave out over 300 vaccinations that day in a 4-hour period. So we're very happy and we're very confident that we have all the protocols in place, that we're going to have a very good battle rhythm, that we're going to be able to turn around within 24 hours once these programs expand to the point where it reaches the general public. So that's where we stand at this point. I just want to echo what the parish president and Dr. Kanter and so many of the former speakers have said, is that we are going through Christmas holidays. We are going through the New Year's Eve. I I know in my particular case, I typically have 25 people over for Christmas. We cut it down to 6, just immediate family. We're going to observe social distancing rules. Everyone's going to be wearing a mask. And so, we're very close. We can see the light at the end of the tunnel with this vaccine, so we have to give it a chance to work. So all I can please say is that exercise extreme vigilance over the next 2 holidays that we're going to experience, Christmas and New Year's Eve. Thank you very much.
Thank you, Joe. I want to thank everybody for being here today. Does anybody have any questions for any of our speakers up here? Yes.
Just when it comes to schools within Jefferson Parish, I know a few schools actually went virtual this week. I know, we see a light at the end of the tunnel, but what happens with the schools right now? Like, are you considering maybe going virtual throughout the school,
So actually, that's not a decision I make. Dr. Gray is the school superintendent, and obviously the private schools are a different system, but I know they're trying to manage it very well. I think it's on a case-by-case basis as schools go. Different schools have had to quarantine much more than others, so that would be more of a question for the school system. Yeah. Real one? Yeah.
So we're urging people to change their behavior. This has been ongoing for the last 10 months. Obviously, JP is the largest parish in the state, so high case count is to be expected. Yesterday was close to 400 new positive cases. For people who aren't getting it, or what needs to be done to bring those numbers down?
You said it, for people who aren't getting it. I don't know why anybody wouldn't get it by now. I mean, I hate to say, if you don't get it by now, you're just kind of burying your head in the sand, or you're not able to process. We're in a global pandemic. Global pandemic equals social disruption by the very nature of it. And so I know there is a frustration with things, but this is where we are. People get upset about some of the results of us being in a global pandemic, but we have got to see our way out of this, and it takes a whole community. I'm very, very happy with our business community, too. They've had to change up, and when I go out, I see a lot of these practices in place. It's people's personal lives, I think, is where we're really at risk, and what they're doing within their homes and what they're doing in their private lives. That's a behavior that individually we all have to square away with ourselves and decide. I know me personally, I'm saying I got this far without getting this virus. I'm really, the vaccine is right there. I'm just determined. It's like when you're at the end of the race and you just find energy to just, I used to run track. Energy comes from somewhere, and you just push it harder through that finish line. That's how I envision this right now, is that I'm very, very determined to never let my guard down and get through this until myself and my family can get vaccinated, because we're here. We're here right now. So many of us on the stage have been vaccinated already. So what a tragedy it would be if the vaccinations were out, approved, already starting to be distributed in the community, and you get it, or a family member gets it, and it's a critical case. You'll be kicking yourself, is what you'd be doing. So it's a personal choice, and it's personal behaviors that need to change, and all we can do is stress the importance of it. And for people I know who got it, they will tell me, my friends, it's easy to get. And Cynthia, everything you're saying is right. It's so easy to get, so it wasn't that they let their guard down so much, or maybe they did, but they're saying, the people I know got it, you don't want it. You don't want it. And there's some lasting effects, and I don't want to speak, we have medical teams here. Some people get in a mild case. It seems my friends have had lasting effects of it. So I don't want to put my family through it to even have to come home and say I have it. I don't want to do that to my children. So these are the personal decisions we all have in our lives that we have to square away with ourselves. Okay? Yeah.
Go ahead. You mentioned the business community, and today we spoke with some businesses. We were saying they're struggling. The last councilman meeting talked about the Fat City areas outside of Lakeside that are struggling. Can you tell those businesses that just...
This is a struggle that we have been struggling the whole time, and it's so difficult to watch businesses, small businesses especially, just, frankly, fight for their lives. Unfortunately, we have tried to balance things in Jefferson Parish. I will say, if we look at the beginning of the year, I never would have thought we would be here. The sheriff just released the receipts for the sales tax receipts for October activity. And surprisingly, in Jefferson Parish, we're basically at the same as we were last year. So it shows that our economy has been extremely resilient through this. We're a very diverse economy. But having said that, we've lost some businesses, and businesses are hanging on now. So we want to encourage you, especially, you know, with the season now and a lot of spending, if you're not comfortable going into the malls, do the curbside, do online with your local businesses. I know I take out from restaurants a lot. I've been going to restaurants that I never even, you know, would go to before, and so my spending is really the same. It might look different, and we want to encourage everybody to do that and find new ways to support your local businesses. Yes.
I know Jefferson Parish, y'all are following the governor's phase 2 mandate, but as we're seeing this surge, do you feel like there should be more restrictions to help slow the spread?
You know, I've looked at that, and I want to say, and I'll say this again, in Jefferson Parish, we don't have our own medical health unit. I think Orleans Parish is one of the only in the state, Dr. Kanter, one of the only in the state that do. I'm a public policy wonk. If I'm going to make a policy decision, I'm going to have the backing, I'm going to have the data, I'm going to have somebody on my staff helping with that. Our medical health unit is Louisiana Department of Health. Our taxpayers fund that. That is our health unit. So I'm not going to go out on my own making these decisions to restrict us without the data behind it. So that is why, really, consistently, we followed along with the governor's order. Not that I'm not willing to, but I want the backing of a medical person on my staff and the data. And frankly, I don't get that data. I get the data when you get the data at 12 o'clock through the dashboard. I'm not getting other data, other means, an inside line to that. So I'm just from a public policy perspective, I would never be comfortable doing that. So that's why in Jefferson Parish, we follow the state guidance. Yes.
You guys were talking about the open pod, when the vaccine will actually be available for the general public. If you could just explain to me how things would go at the Alario Center when this does become available.
I'm going to let Joe Valiente handle that because it will be his operation when it happens, okay?
Sorry, could you repeat the question, please?
I know you were talking about when the vaccine does become available to the general public. How will it go at the Alario Center?
So right now, the Alario Center is going to be our primary open pod site. However, we plan to have other ones if it's needed. We know that the Alario Center probably will not be able to handle the entire Jefferson Parish area. But we do have the model, we do have the template to use, so we can just set up other sites. We have locations on the East Bank, and we have locations in Kanter that we can set up when the availability of the vaccine actually comes into place. And it's a complicated process because LDH we have to be embedded with LDH. We also have to be deeply embedded with the contractor that we choose. So, you know, all those things have to happen, and everyone has to have the capability in terms of the resources, manpower, and of course the locations. The locations we feel comfortable, very, very comfortable with. We feel comfortable with our game plan as far as we think we can set up the Alario site anywhere in Jefferson Parish. So it's going to come down to the availability of the vaccine, and it's going to come down to the support that we can get from LDH and from the contractor that we ultimately choose to go with.
Thanks, Joe. I think it's a couple of things to keep in mind. It's a number of months away. And by the time the vaccine is going to be available in quantities sufficient for the general public, we're probably talking about summertime. Don't know for sure. And the other thing is the expectation is that there's going to be multiple options of where folks can go and get vaccines. So our expectation is by that time, vaccine will be available in pharmacies, in both big chain, Walgreens, CVS, Winn-Dixie, Walmart, as well as local independent pharmacies, likely in doctor's offices, and then likely in pods, like Joe said, and that people have a choice, you know, to go where it makes the most sense to them. But the challenge here is that it really is still on the horizon, and we got to get through phase 1A, which is now, then phase 1B, and phase 2, and then phase 3 is general pop, and probably talking about summertime when that happens.
When it comes to teachers and students, I mean, I get a lot of emails from teachers about just them wanting to be a part of these, these first phases. When do we think that teachers and administrators might get a chance to get vaccinated?
Yeah, absolutely. I'm really encouraged by that. I think that's a really good example that they're setting. We hope really soon. Again, and we're going to look to what the CDC says. And the challenge here is that, the first thing we have to do with this vaccine is prevent mortality and prevent people from getting hospitalized. I mean, both because that's the right thing to do and because the hospitals are really overflowing right now. And so when the CDC weighs these balances, there's a lot of people that are on the front line of whatever profession they are. They're really trying to weigh that against what the mortality risk is right now and who is suffering the most serious clinical consequences. It's a hard decision. So I'm really encouraged to hear that. I mean, I think we'll see what the CDC says, and we want to get teachers have been on the front lines just like a whole lot of people have, and want to get them done, really as soon as possible. For students, we still need more data. So the Pfizer vaccine was evaluated in people as young as 16 years old, not below that. And the Moderna vaccine, I believe, went down to only 18. The companies just now are starting to enroll younger kids in the trials, but it's going to be a couple months until we get data on how safe and effective the vaccine is in kids. I don't think we'll be talking about vaccinating children probably until the summertime either.
Any other questions? No? Okay. Thank you all so much for being here. You got to have a great Christmas and holiday season. Thank you.